Hi everybody, we're going to be doing a tutorial on the Sigma Spectrum pump, which is the pediatric pump at the hospital. For all our pediatric thrombolysis patients that are going to the PICU, you need to use this machine, not the adult machine. So I'm going to show you how to do it. The tubing that we use is our primary tubing that we use for all patients. And what you want to do is prime it as usual for thrombolysis. Make sure your roller clamp is low enough on here. So I'm going to move it down a little bit lower on the tubing so it will go into the machine. To turn on the machine, there's this blue clamp, and that will act as a key to open the door, which is here. And you press it and it will turn on your machine. And then you're going to follow the instructions that come up on the screen. So you're going to load the set. Number 1 is the clamp. We're going to push it in, put in number 2, push it in more, number 3, and number 4. When all of those are checked, you can now close the door. Use both hands. Now what pops up on the screen is care areas. For thrombolysis, the patient is going to be in PICU. So we're going to scroll down to PICU by using the arrow keys. We're going to go to PICU Cath Directed and press OK. So now we're going to type the first 2 letters of the drug name. So we're going to press A, which is 1, and then here we're going to press it 3 times so it says L. And what pops up is Alteplase. You're going to highlight it, use the arrow keys, highlight it, and press OK. Alteplase is the only concentration that they have for PICU is 0.01 milligrams per ml, which is 10 milligrams in 1,000 cc's. That is the only concentration that you can use for pediatrics. Make sure you tell your doctor that is the only concentration that they can use. Right now what is highlighted is your dose. So we'll say for this patient the dose is 1 milligram per hour. You'll press 1 and then press OK. It will auto-populate the mLs per hour according to the calculation. Now we're at volume to be infused, so we'll put in an amount. We'll do 950 and press OK. Now it says pump stopped, open slide clamp, which is up here. So we'll pull that out, and as we're pulling it out, it'll open the clamp. Now there are 2 options here for it says the pump stopped. Either you can run to start or hold for standby. If you set up your pump before your patient comes, you can put all your information in and then press hold. And that will keep all the information in the pump and not alarm. It'll put it on a hold. So now let's say we're done with your patient and we're ready to run the pump. Make sure this is still unlocked here, and also check your roller clamp and make sure that is open. We're going to hook it to the patient as usual and then press run to start the infusion. It will ask you are all clamps open, which that is open, and your roller clamp is open. Is the tubing kinked, which we had the check marks, and are drops flowing? Yes. So press yes, and it will start infusing your Alteplase.